With the Advanced Skin and Laser Center here joining us tonight, Dr. Benlam, we have had a great chat this evening about falling in love with your skin again, emphasis on fall.
That's right.
I do want to briefly chat about this event coming up. We're going to talk about this. It's the Fall in Love with Your Skin again. It's the Autumn Cosmetic Fair, and that's going to be coming up October 19th.
The 19th.
Wonderful.
Between 3 and 6 p.m. And we're inviting our customers, our patients and their friends and family to come and learn more about what is available out there to help the skin.
I think maybe the main reason folks should come check this out, in your opinion, what would they really benefit from attending this?
Yeah, so what we'll have there, and it's a very fun event because we'll hand out prizes. People will actually get to talk with our staff, with me, my physician assistants, and also talk with the different vendors about the different things that we offer that is available in the realm of cosmetic medical treatments and procedures. And I will be there to serve also to tie in all these different things that people may want to do or are interested in.
It's more or less a consultation in a way. With, I heard there, you know, food and wine, bring friends, kind of make a night out of it. It's a lot of fun, so folks be sure to check that out. Now, before we went to break, I did mention that I kind of wanted you to walk me through a typical, what folks can expect when they're going through a consultation. You're nervous, you've never, you know, maybe thought about doing this type of cosmetic procedure, medical procedures before, but you're finally shown some interest. Walk me through what would take place.
Right. So, Casey, when people come into the office for a cosmetic consultation, certainly like with any medical practice, we would review their medical history, their allergies, their medications, so procedures that they've done before in the past, if they've had any problems with any procedures, how did their skin heal from injuries or from procedures. So we want to know all those factors. Do they smoke? Do they drink? Because all that can also affect the results of things that we do for them. But once we get through all that, one of the most important things is that I like to give people a mirror, and sometimes this is the part that people get uncomfortable with, is that I give them a mirror and I ask them to look in the mirror and tell me, when you look at yourself in the mirror, what is it that really bothers you? And tell me about it. And I encourage people, if they have pictures of how they look, maybe 5 years ago, 10 years ago, 15 years ago, let's look and see what the process of aging and photo damage has done, and we will then map out a treatment plan to try to bring people back, to roll back the years so that they will look better.
That's incredible. What, just out of curiosity, what would be maybe the most common answer you receive from folks about what they're most unhappy? Is there, or is it a broad spectrum?
While there is a broad spectrum, the consumer survey that was done nationally showed that what people were generally dissatisfied with about themselves involve wrinkles, involve dark circles, it involve skin discoloration, whether they have pigmentary conditions such as melasma, or sometimes it's called the mask of pregnancy, where women can get dark brown splotches on their cheeks, upper lip, forehead.
Due to hormone changes.
Due to hormones and other things. Also, unwanted fat. They don't like to see certain areas such as a little jowling, or underneath the chin, get that little roll underneath here. Or sometimes they feel as though they frown too much, that there's so those are the things that we would address. And then also people start talking about, well, things are starting to sag. What can we do about it? Because one of the big fears that people have is, I don't want to go under the knife. I don't want to have surgery. So what can you do to help me, short of me going to surgery?
Yeah, okay, so let's move on. We still have our 2 R's left. We've been covering them all night tonight. I think it's kind of a you know, fun way of looking at this. And we have repositioning next that you wanted to discuss, and then we're also going to go ahead and touch base on reshaping as well as we end tonight.
Right. So with repositioning, there are different everyone has a little bit of asymmetry to their face, and so some of the repositioning could be small things, such as, for example, sometimes the nose starts to droop. So what can we do to reposition the nose so it doesn't droop? Or people may have a little bend along the nose, and so they want to smooth that out. So rather than going into surgery, now we can actually use fillers to help correct that. Also, in terms of repositioning, we can use fillers in order to give what we call a quote-unquote lift, because it re-inflate the face in a natural way. Then things don't look as descended, they look positioned more upwards. And then we're not trying to erase every wrinkle that people have, because it's natural to have like smile lines and the like, but we want to soften it so it doesn't look deep. We don't want to have things that kind of sag too much, because that also makes us look sad. So we can reposition things. And one of the latest innovations I think is really unique is the use of actually absorbable sutures that when you place it into the skin, you can then actually, following the vectors of movement of the face, you can use it to reposition the face and bring things back up.
So a non-surgical facelift in a way.
Yes.
Maybe.
Yes.
Yeah,
So
okay.
it is, in a way. It's repositioning things. So it looks very natural. I will certainly say that, you know, if people have really saggy skin, they do need to have a facelift. But if we catch people earlier on when things are just starting to descend or sag, we can do things now to reposition.
It's incredible, the advancements, and you know, through the years, how are you able to just stay up to date on all of this? And it is exciting to know that we just keep finding more ways and more ways to make this less invasive, more comfortable, and as you said, natural.
Right. So it is a lot, but at the same time, because I started from the very beginning, when things started to develop back in the 90s, I've always stayed on top of things, and I've been blessed to have colleagues who share information with me, and I share information with them. So we learn from each other, and certainly it's very important that we always stay up to date with what I call continuing medical education events, so that we see what's out there and we learn from our colleagues, not only in the United States, but actually internationally.
And real quick, you mentioned earlier in the show talking about, you know, getting treatment from a professional versus the other option. How does someone know what to look for? Obviously, a dermatologist, great example of who to go see, but what are some things to watch out for and just be a little careful of?
Right. So when people go to a medi-spa or to an office, you really want to ask very carefully what is the credentials of that individual that may be doing a procedure on them. And when you ask about the credentials and people say that they're board certified, it's very important to ask, well, what are you board certified in? Because it's one thing to say that someone is board certified in dermatology, plastic surgery, but if that's not their core competency in terms of training and experience, they may not be the right person for you. And I think that comes back to just asking and seeing the results of what they've done, and then making sure you feel comfortable with who you're talking with.
Great. You know, and again, just a reminder, the fall in love with your skin. Again, I love that phrase. Now, I may have asked this already, is this the first year for this, or is this something you do annually?
This is something we do annually, and we actually also have a spring event and we have a fall event, because each year there's always new innovations, and we want to keep our patients and our customers, clients, all up to date about what's out there. And I try to curate all these services and products in a way so that we're delivering products and services that actually have a benefit for them.
Yeah, like some of the similar treatments that you actually brought in this evening, which I'm so glad you did. That kind of gives folks a chance to really get a visual idea of what to expect. And I love that you were able to walk us through what a consultation would be like, because again, I think you know, just kind of clearing the air of the stigmas or any questions. We've come a long way in advancements, and I'm really happy we were able to touch base on a lot of those this evening. So we're going to go ahead and take another quick break. Keep it right here. We'll be right back with more Medical Monday.
This is a Storm 5 H